work for the NHS. You've had a great idea, you've made it happen, and it's made a big difference to how we can learn from COVID-19 and enter a new normal. Ideas like yours drive improvement and they deserve to be shared. That's what BOB does. Amplifying good ideas like yours across the NHS so as many people as possible can learn from, adapt and implement your idea. The further good ideas are shared by the BOB community who learn from them, the greater improvement we can achieve. You made a change. Share your solution with others. Speak to BOB.
Hello everyone, I'm Marc, one of the co-founders of BOB.health.
And I'm Crump, the other co-founder. So thank you very much for joining us for this introduction. This was meant to be played or actually live yesterday morning, but as many of you might be aware, the giant platform blew up as 20,000 odd people logged on. So our session all went drastically wrong and stopped recording. So we are re-recording it on the night of the first, and this will be played on the morning of the second. So this is a recording, but we are live in the room, the chat. So if you have questions, pop them in the chat and we will answer them live. So the other thing just to say is that we are obviously that lots of people are tweeting about the conference on the hashtag Giant2020. And for this track, the hashtag is hashtag unpack the how. So unpack the how. And the BOB Twitter account is at BOB.health, dot spelled D-O-T. So it's B-O-D, D-O-T, sorry, I'll start again. So that's B-O-B-D-O-T-H-E-A-L-T-H, BOB.health. So without further ado, we will start the presentation. So Marc and I are here to talk about unpacking the elusive how-to behind good ideas across the UK healthcare system. And so I'd like to introduce you to BOB.health. And here is the website. Our rally call to NHS staff is you've made a change, share your solution with others. So what BOB exists because we're a completely free service for the NHS, and we have a self-guided writing engine which makes it easy for NHS staff to create an impact story which will basically accurately capture the problems they faced and the insights they gained about making a change at the local level. So those changes could be big changes, so it could be a service overhaul of an entire sort of a ward or a department, or it could be something as small as a roster change and sharing that experience with other people. Now, this all started because a number of years ago, I attended a meeting where this chap is on the screen. He's called Andrew White. He has a role within Devo Manc. He was based in Salford, and he was talking about how they actually, introduce a new medicine into the system. And as he talked, he started talking about how, they were looking at the data, the phase 3 data again, they were looking at the health economic modelling. So I put my hand up and said, well, haven't MHRA and haven't NICE already done that? And he was like, yes, Neil, they have, but that's what we do, we dig into this. He talked some more about it, and I put my hand up again and I said, look, Andrew, have you not, are you the first person to introduce this innovation? He's like, no, we're not the first. We do ask around a bit, we tend not to find anyone. So yes, we reinvent the wheel pretty much every time we implement something. So I thought that was a bit mad. So I went bounding up to him at the end of the session and said, can I come and see you? So he said, yes. So the next week I jumped on the train, went up to Salford. We went to Tesco in the cafe, and Andrew kindly sat with me. We had fish and chips, and we talked about the challenges that he faced around introducing innovation into the system, and I was hooked. So the problem that we are digging into as a organisation, which is the next slide, is the challenges that When starting an NHS project, big or small, NHS staff find it hard to discover the experience and practice of others who've delivered something similar. So this is the problem that we are helping to solve through the platform, and the one that really was brought to the fore by Andrew. So we developed the concept. This is the team of 7 of us on the slide who developed the core concept. So there's myself there, then there's Frida, Stephen, Arthur, Laura, Chris, and there's Marc. And the arrow's pointing at both Frida Kutunda and Laura Bailey, who both worked really closely with me and put a huge amount of blood, sweat and tears into developing that concept. So I just want to say huge thank you to the amazing Frida and the amazing Laura. So moving on to the next slide. People often ask us, why are you called Bob? Well, basically, Bob is the person that you turn to in an organisation and you ask them, have we done something like this before? So that's who Bob is. Bob is that person with institutional memory. They've been around for years. And that person that when you ask them, they can say, yep, 6 years ago we had an initiative like that. They can jump on the server, they can pull down resources, and then they can be really helpful. So that's who Bob is. That's what we're trying to create online.
Thanks, Neil. So looking at this challenge of experience sharing, why is it so hard? So when, as Neil mentioned a few years ago, we got together around this challenge, and since then we've been talking to numerous folk across the NHS in varying different roles. And we know change is difficult. Change is difficult in any setting, and this is even more pronounced in the NHS. And some of the things and the reasons we heard behind that were that, well, since 1990, when the National Health Service and Community Care Act was created, it formed an internal market. And because of that, it meant that we have these highly devolved, legally independent structures, organizations, sorry, and really the incentive there was for them to focus on their own performance. And so it was more competitive than collaborative. And although it has changed a lot over the last few years, we still carry some of that legacy with us when we look at the health system. And there is also tremendous efforts across the system to try and address that. So change is hard. It's also been tricky because of the structure of the NHS. And so as we come out of this now, looking at the situation, there still needs to be more work done to really move that on. So those are some of the things we heard. And there's Betty looking very confused. So looking at the individual level, why is it so hard in practice to do this? So beyond just the system level, for the individual, we know that everyone's busy, and especially people in the NHS, and especially over the last few months. People are busy, and there is a little incentive to find the time to share. And that's something we just heard. It's natural, it's human behavior. As well as that, if someone does go out there and they want to try and find a project that's similar to what they're about to embark upon, they do what we all do. We start with Google and we go looking for information. What they might find, if they're lucky, is information that's published. It's rather haphazard. It might be in silos. And what it tends to not have is what we call the how-to elements. And so it might have a top line headline, and there might be a couple of bullet points. But what generally is missing are those lessons learned and those very specific things that people have done that, if they were replicated, could really lead to some successes with their projects. So that's another thing that's missing there. And finally, what we also heard was that when someone has, it's not an individual, but when an individual and a team have brought together various aspects around a project, and they've made this amazing change, they've delivered results, when they move on a few months, years down the line, sometimes if these experiences are not captured, then those are lost. They're lost, and the organisation cannot find them again because it's the people that have moved on. So those are 4 of the key things that we heard around why experience sharing was so hard in practice, and some of the things that we've used to help build Bob. So on this, actually, there's a couple of sessions which we've got in the agenda today, and these sessions really look at the human factors involved in capturing knowledge and experiences and sharing them. And the first one is called Building Confidence and Sharing Your Good Ideas with NHS Colleagues, and this features a couple of a couple of our authors from the Bob platform, talking about their experiences of sharing their ideas, why they've shared them, what they learned from the project themselves, and also by sharing the information on the project. And then we've got another session directly afterwards, which is looking at the theory behind spreading and scaling ideas and innovation. So again, looking at those human factors, we're joined by some behavioral scientists, some psychologists, a digital sociologist there to really unpack some of those human factors, which really are quite fascinating as to why things move and why other things don't move. So that's some flags for some interesting sessions today in this Bob track. All you have to do is stay in this channel and you can get those. And then just revisiting Bob itself, and this is a picture of all the amazing people that have been part of the team over the last couple of years, really pushing us to where we are today, all the way from the beginning through to us having a real life functioning product. And one thing that unites all of these people is our values, and we're really keen to share these values, and they are being kind, collaborative, resilient, and trustworthy. And I have to admit, when we first started this exercise of building the values, I thought, oh, this is a really cheesy corporate exercise, isn't it? But actually, looking back now, this is actually probably one of the most important things we did, and we did it very early on when we were setting out our company, because we hire against these values. We evaluate whether or not an organization is worth collaborating with, and really it defines who we are and who we want to work with, who we want to be with. And very important, actually, one of the key things one of our hires, Nick Vogt, said to us when she joined was, actually, you know, your values are pretty similar to NHS values, and for Neil and I, that was a big tick in the box there, knowing that we are aligned with the right organisation. So very important for us to keep these values. And it's important because, as I said, looking at the collaboration partners we have across the NHS, BOB.health NHS Foundation Trust were the first collaboration partners we had. So Dr. Jill Bailey and Professor Charles Vincent are two of the people there that we work with. Actually, when we started working with Jill, when we first met with Jill a couple of years ago, we all sat down around the table, and Jill was describing some of the challenges that she had faced around sharing and dissemination. And Neil and I expressed our kind of vision and goal for Bob, and it was just immediately like, oh, we're saying the same thing here. This is fantastic. So we immediately have this shared vision, this shared purpose, and shared values. So it's really important to us, and we continue working with Oxford to this day. And one of the ways in which we've been working with our collaborative partners and others across the NHS is really co-creation. So everything we do on Bob is built with NHS staff in mind. And so what that looks like is it's either research with NHS staff, or it's actually designing and creating and mocking up screens, making sure the language is correct and that things look correct in terms of an NHS mindset. And as you can see, some images from a workshop that we could do when we were able to be in the same room together. So we've been working closely with 28 NHS staff Bob champions to do this, and it's something we'll continue to do. Bob is always going to be built with NHS staff helping us along that journey. So just looking at some of the pieces now that might motivate people to share. And again, this goes back to all these interviews that we've done, these conversations we've had with various people across the NHS. We know that in terms of people's role, it certainly is part of a number of people's job role to share. And whether that be an innovation type role or a quality improvement role, many roles have this as part of what they do, whether it's official, formal, or not. And it's about knowing certainly where, how to do these kind of things. Where is the best place to share? How do I do this? For a lot of people that we spoke to, they said, well, yeah, I'd love to do it, but I've never done this before. How do I begin? Another piece is altruism. Now, we believe most people that work in the NHS, this is just kind of almost a point of entry, really. Everyone has this belief. Everyone is there because they want to help other people. We know that's important. So it's a big driver, because in sharing your knowledge with other people, you're helping other people. Ultimately, you're helping patients at the end of the day. And the third thing is, these projects that we're talking about, as Neil mentioned, they range from big to small, but ultimately they're always a team that's about solving or resolving something and coming up with an outcome which is a positive outcome for people. And in doing that, people want to share that, and in doing that, they can be recognized for the good work they've done as a team. Because it could have taken a lot of time. It could have been a really, really nasty, tricky problem to solve. So at the end of the day, people want to share something good, but equally, people also have had a desire to share something which didn't go so well, because they know that actually that's probably the most meaningful, valuable thing they could do for other people who are looking to start that project themselves. And finally, the other thing we heard is that supporting career progression is really important. So in sharing this information with others, or even just capturing this information in a form that people can learn from, really helps. It provides that evidence for people, whether it be an appraisal conversation with your line manager or CPD and revalidation. So those are 4 of the things that we've heard from people that would definitely motivate them to share their story, their experience of a project. And then looking at it from the other side, looking at it from a BOB perspective, writing a story on BOB also solves a problem for the author as well. So as I mentioned earlier, people move on and the ideas and the experiences can be lost. So writing a story helps to ingrain it, capture it in that moment in time, and help support local embedding within the organisation. Also, within a BOB story, there's a good section there around outcomes and actually the impact of the project that you've created. What does it look like? So it's a way in which you can capture that impact that you've had in a story. The other piece is that it also supports discussion with adopters. One of the other things that we heard in the interviews we had was that people will go look for a project online, they'll Google. If they're lucky, they'll find something, and if they're even lucky, there'll be contact details. And what the behaviour tended to be was that they would go and they would speak to that person. They'd go meet up, have a coffee, and they'd have a great chat. They'd talk about the project, and then the adopter would ask the innovator, the improver, a question or several questions around the project. And what they're trying to do is to try and find the good things, the bad things, the things to watch out for, or the nuggets that really help push them on. And that will happen on numerous occasions. But what we heard is that after a while, it becomes a bit of a challenge for that innovator, for that innovator and that improver to be there always to share the information with the adopter. They just can't be there. It's not their full job. So what we heard is that if there was a place that they could point people to that did capture some of these how-to elements, these Q&As, that would be great, and that would save them time. So that's what we can do in a BOB story, capture some of those key things. And the final thing to say is there's also this piece of reflective learning for CPD. When you write a BOB story, going through that process, it's asking you to reflect back on certain things, experiences that happened throughout the project. And in doing that, it then fulfills one of the key criteria of many CPD requirements, which is about reflective learning. So actually, by just taking part in a BOB story and creating that, you're also creating yourself evidence for CPD going forward. Oops. Okay.
So our latest story that got published today is from an amazing radiologist, Dr. Anu Abaro, and she has written a story about giving a presentation within her trust on racism. It was all sparked by the death of George Floyd, and it had an enormous impact on Anu, and she decided she wanted to give a presentation about racism and actually about being anti-racist. So this was a really high stakes thing to do. She talks in her story about what a big emotional load that was, but she actually unpacks how she went through the research, how she drew on her personal experience, and she created a really powerful presentation which has been watched quite extensively. It's mobilized action within her trust. She has the support of the chief exec, and there's been a whole big amazing ripple effect as a result. So she is sharing her research and all her findings. So it's a really amazing story, which I'd really encourage you to go and read, and then also then to watch the presentation she gave. It's unbelievably powerful, and we're really proud that we were able to help her to do that piece of reflection, and it should save her time. People are coming to her saying, Annie, how did you do that? So she can now direct people to that story as a first port of call to learn. So that's fantastic. So one of the key people in our team is Marc mentioned Nick. So Nick is our quality manager, and actually at 3:45 today, she is doing a practical demo, and there's going to be available for Q&A. So she can really show you how our self-guiding writing engine works, and the editorial support that we can offer. So on the next slide, I just want to give you a glimpse of that writing engine. So it is a self-serve model. You sign up for free, you can come in, you can create your story, and you basically work through three key sections, and it's a Q&A format. So you're asked a question and you're asked to give a nice, concise answer. So it would be, it is actually possible just to guide yourself through it, and many people do, but we can offer you that additional support if you want it. Though stories visualize, it looks something like this when you read a story. So you have a navigation on the left, you work through a story, you can read it as a full page, and then also with a click of the button, Marc, you can do two other key things, which is to actually ask the author questions. You can make contact with the author. In this case, you'd be contacting Oliver about their virtual consultations that they rolled out in response to COVID. And the other bit of key functionality is to share the story with your peers. So you can send it as an email or into social media. At the moment, about a quarter of everyone who reads a story, a quarter of the people who share a reader story, share it. So we're looking to really push that figure up. If you found this story useful, what we're trying to encourage people to do is to share it, because other people are likely to, in their network, are likely to benefit from it. So the more we can share stories, the better and the bigger the impact these stories can have. So over to Marc to talk about our new sponsored offering.
Absolutely. So actually, again, another highlight for today was that we've had 2 sponsored stories go live on the platform, and the sponsored stories, and we'll talk about those in a moment, a bit more detail. So the kind of people, NHS suppliers that can sponsor stories on Bob really are far-ranging, anything from medtech to non-NHS healthcare providers, non-clinical providers, pharmaceutical companies, and external consultants. And what you can see on the right-hand side are just some cards that are a summary really of the story that you then click on to read more. But you can see here, they're clearly denoted as sponsored stories in orange there, and very clearly summarize the project itself there. So, excuse me. So we've got 2 examples there from Concentric and also from Sky as well. And the 2 examples that we've got there are going to be building over the next few months. We have other suppliers, other NHS suppliers that have also got sponsor stories in creation at the moment. So keep an eye out on Bob. There's going to be a few more coming out over the next few months. And so just a little bit more detail around the sponsor stories. So Bob is a free service, as Neil's mentioned, to NHS staff. And the reason why it's free is because we're able to offer these sponsored stories. So just going through this slide, there's an animation here. So what we've described at the moment is in effect 2 sides here. So we've got the NHS generated impact stories, for example, Anu's story that we just saw earlier. And then we've got these NHS supplier sponsor stories that I just showed you on the previous slide.
Marc, you just muted your line accidentally.
I just muted my line. There we go. I'm back. Professional, it's fine. The key thing that unites these stories is that the creator of the story is always an NHS staff member who led the change. So that's key to remember. And as I said earlier, the revenues that we generate from these sponsored stories enable us to provide a free of charge service to NHS staff. And as it states here, all the declarations of interest are made very clear on the sponsor stories. As you could see earlier, they're denoted as sponsored, and also we state who the sponsors are very clearly. And there's extra information inside the stories about what the sponsors did and how they supported that site. So Bob will always be free to the NHS staff, to NHS staff, and that's a promise. And just the other pieces to say here is these builds that we've got here just reflect some of the additional modules that we'll have coming out. So at the moment, our free NHS module is an improvement module, and it really catches we've designed it to catch as many possible projects in the NHS as possible. And then from the NHS Supply sponsor story side, we have in effect 3 different types. So we have one which is about innovation, introduction and support. The second one which is about NHS partnerships and collaborations. And the third one which is more focused around service and pathway redesign. So it just covers off slightly different elements of the story that we might have when we've got an NHS supplier working with an NHS locality and potentially some other collaborators in the mix as well. So it's to cover all those bases. And the last thing to say here is that Bob is an advert-free zone. There will be no banner ads on the site. And the way in which, well, I've described to you now that NHS suppliers can sponsor story is the way in which we will have sponsorship available on the site. There will be no banner ads. So this is an example here of the Sky Medical Technology story. When you click on that card on the site, this is the way it looks. And if you recall from the previous slide we showed you, very similar. The biggest difference is that we have this section here, which is the author, sponsor and collaborator information. If you click on there, you get further information about the company and, as I said, about what they did to support that particular NHS centre. And here on the right-hand side, you can see it's very clearly flagged that this is a sponsored story. This is, if you click into the author, sponsor and collaborator information, this is what you see. So you get further information about the author themselves, about what they did, what challenge they were trying to tackle, as well as more information from the sponsor's perspective, talking about the innovation that they introduced, and also a little bit more information about some context around how that came about and what that was addressing. So that was a whistle-stop tour through some of the pieces that we have on Bob, but leaving you really with this last slide, which is I guess a vision really for us and a goal for us, is that we are here. We want to build a national learning platform that the NHS really deserves, and everything that we've done on Bob is really in response to everything we've heard from NHS staff members across every different role, grade, band, and type of discipline really. And we believe that by putting them all together into one platform, people can learn from each other in different disciplines and in different areas. We don't want this to be siloed. We want this to be open to all, because we believe the NHS deserves that and the ability to learn from that.
Yeah, so we're really proud that we've, out there. We're here to help. We want to help people tell great, authentic stories about how hard it is to make change happen. And thank you so much for listening. Enjoy the rest of the day with us here. Enjoy the rest of the tracks, and do take a look at Bob. And if you've got a story to tell, we're here to help you do that. Get the word out. It can be a big project, a small project, but know that you can make a difference by sharing. So thank you very, very much.
You work for the NHS. You've had a great idea, you've made it happen, and it's made a big difference to how we can learn from COVID-19 and enter a new normal. Ideas like yours drive improvement, and they deserve to be shared. That's what Bob does. Amplifying good ideas like yours across the NHS, so as many people as possible can learn from, adapt, and implement your idea. The further good ideas are shared by the Bob community who learn from them, the greater improvement we can achieve. You made a change. Share your solution with others. Speak to Bob.